chair. Okay, so you guys, this is your opportunity to really ask your questions. We did get a bunch of questions that came in that we will be answering, but as always, okay, there is a way to jump the line here on My Baby Experts. Okay, you know how to jump the line? I'll tell you how to do it.
Ooh, I don't know. How do you jump the line?
We get so many questions. Okay, we get so many questions, and so often we can't answer them all, and then everybody posts. And the last time I asked for breastfeeding questions, I think I got 75 questions that came in. I'm still answering them from the other day. Okay, but if you want to jump the line, does anybody know how to do that? They know how. They know how. The way to jump the line, turn on your camera and jump in with us, and we will take it right now. Okay, that's how you jump the line. If you have a burning question, all right, if you have a burning question for either me or for Dawn, you're going to go ahead and go over to this link. Let me go ahead and bring this one down and put that one up. Hold on one second. Okay, if you want to jump the line, all right, go over to, let's take this out. Hold on. Can I remove that? Yeah, let's do that. Hold on. Whoop. I'm going to make it easier for you. All right.
I can grab questions from Facebook and the comments too.
Okay, so this bit.ly, okay, MBE live. And you have to type it exactly like that. All right. If you type it exactly like that, and actually I put it into the post. So if you come out of the stream and you just go right into the post, you can actually click on it. Okay, it's the one that says MBE Live. If you do that, you'll be able to turn on your camera. I'll see you sitting here waiting for us. And when you do, I will pull you in and you'll be on with us and you can ask your question live and we will do a little consultation with you. Okay, so go ahead and do that. That's how you jump the line. See, now you learned something, Dawn. Oh, I just lost your audio. Uh-oh.
I coughed, so I turned it off and then I forgot to turn it back on. Sorry.
Oh no, we've been having those problems. Okay, so let's just talk about the Nomi chair. Okay, because that is our giveaway. We are both huge fans of the Nomi chair. I know you guys all love it. You're all getting an opportunity to win one. Let's pull it up onto the screen for a minute. How about we do this? I have a really cool video. Let's show the video, and then let's talk a little bit about, before we get into questions, I want to talk about some of the features specifically of the Nomi chair and how that relates to what you're trying to accomplish with your child when you're feeding and why it's so great. Okay. Perfect. So let's pull that up, and then let's pull us.
Sometimes I can stay on my feet when I see your pretty face smiling back at me. I have all you could ask for in life, but I'm old enough to know what matters, what you give. Right at hand, we move to unknown lane. We try to understand. So put your heart in it and don't pretend. Just bring it. You open your eyes and the moment you try, you can.
There we are.
Hey.
Okay, awesome. I love that video. It's so cute. And it really,
is cute.
It really does go through all the different features of the Nomi chair. let's discuss. Okay, let's discuss some of it, because, you know, people just think, oh, I'll just get a high chair. And what's the difference? As long as it's considered a high chair, not all high chairs are made equal.
Made equal, not at all.
You know, I know that Dawn completely agrees with that. I'll pull up some pictures too. The biggest thing, you know, one thing to know about this is that it really does last forever. I mean, you're really, I sat in this chair, and
I sit in it every day. It's my office chair.
And so it's very comfortable. It can last from infancy all the way to adulthood. You will use this chair for many years to come. It does adapt to your child and size, and it holds up to 300 pounds. So yeah, it's fantastic. Dawn, tell us a little bit about it, because I know you have a lot of opinions about this.
I do. My number one comment about the Nomi is that for me, and again, I'm coming from a safety standpoint first when it comes to starting solids, is that I want to have a footrest that is stable, that the child can actually move during mealtime, be able to be interactive, have that sensory experience, but still be safe. And one of the main reasons that I really love the Nomi, and why I have all my clients that I see for feeding therapy actually encourage them to get the Nomi, is because of that wonderful footrest. The footrest adjusts and goes up and down as baby grows, which a lot of high chairs out there, the legs are sticking out, and so that they're not fully supported. So God forbid baby is choking, baby doesn't have a way to be able to take in that nice deep breath. So if you think about if you started choking, if everyone just kind of plays along with me and pretend that you're kind of choking, the first thing that you're going to do is put your feet on the floor in order to take that deep breath that you need in order to start coughing. Babies can't do that if their feet are just sticking out and they're not being fully supported. So if you see in that picture right now how babies' feet are fully planted, they can actually use their feet to gain that stability to take that deep breath and be able to start coughing it out. So the gagging, I find, is decreased with starting solids with this chair. The choking risk is actually decreased because of that ability for baby to actually support themselves and be active, right? A lot of high chairs either doesn't allow baby to move very well, or doesn't provide baby with that footrest. And then the other thing is that if you can see there on the seat adjusts forward. So we can get that tilt of, we want an anterior tilt of those hips a little bit to be able to make sure baby's in that really nice, stable positioning. Because at 6 months of age, babies are just starting to want to reach and be able to grab that food. And we need to have a chair that fully supports that development of gross motor skills, fine motor skills, and of course, a safe swallow. I tell parents all the time that we're looking for a chair to be able to support baby in order to make those developmental milestones, specifically the fine motor movements, because just like the fine motor movements of your fingers, it's also the fine motor movements of your tongue and your jaw and your lips and your palate. And you can't do that if you don't have a good stable positioning. Yeah. So, you need to tell that's my soapbox.
No, it's totally not. And they're like, oh, this is so interesting. It's things that no one's going to tell you. I mean, you're not going to walk into your pediatrician's office and they're going to, unfortunately, it's just not going to happen. And if you do, like, give me their number, because I'd like to call them and just be like, finally.
Yeah, bow down. If they even know it, that's great. Yeah.
Most don't know what you're trying to accomplish. And this is why having not only, and this is what I always say, it's not just, the combination of what we're bringing here is to have the right information and the right expert to talk to you. But also, it's hard if we have the information, but we don't have the tools to have you use. Okay, so, and I know this is a big thing for Dawn, is making sure that we have the actual tools that go with the education that she's providing and the knowledge, right? Same for me too. When it comes to breastfeeding, there's often, yes, you need your baby and your breast, and that's mostly all you need when it comes to breastfeeding, but there's also additional things that you need. And the Nomi chair is just one of the things when you start going through all the reasons, whether it's the footrest or the back support or, being up at the table. Let's talk about that a little bit, as far as, and it does have a tray, but you can do both. And that's what I love too, because there is kind of like a time for both.
Right. And I'll talk a little bit about the tray. So the tray, this is the tray for the Nomi. So the tray is pretty narrow. And so it actually allows, even with the tray, for baby to be up at the table with you. So there's a lot of studies that say that the farther that baby is away from the table, so usually when I go into a home to do feeding therapy, I will see the whole family is at the dining table, and then mom and baby are over here in the corner and away from that. And why that's important to kind of just think about and visualize is baby is not being exposed to all the foods that the rest of the family is eating. Mom is not eating. So mom is not able to actually show baby how to eat those foods because she's off in a corner feeding baby, right? So if you have a high chair that actually can come up to the table, if you have a tray that is not too huge, that is preventing baby to be so far away from the table, it makes it so much nicer to be able to have baby participate. So we want baby to actually smell all the different foods that everyone is eating, to be able to see all those different colors and be exposed to those sensory experiences early and often. And you can do that with the Nomi high chair because it allows you to be able to do that. The other thing that I love about the tray is that it easily comes off. So you can actually take off the tray, still have baby in that nice restraint, still have baby up at the table, and you can eat off of the table. So you can have a plate or a bowl that's actually at the table, and baby can actually even be that much closer and be a part of mealtime, which is perfect, as you see in that picture there, right? So now they're actually able to make eye contact. They're actually being able to see everything that's at the table. And I love that you can do a variety of different things for your family. And as baby grows and develops, then you can just, take off the restraint, take off the tray. It just ends up, growing with you as you see in the pictures. And that is so important because babies change every couple of months when it comes to meals. And so it's really important to be able to have a high chair that's as versatile as our children are in order to be able to, as baby begins to do something else, like maybe he starts to throw foods off of the tray, well, then you take the tray away. Whereas a lot of high chairs doesn't allow that to happen. So then, we have frustrating meal times, more stress. And that's another thing that I like about the Nomi is that for me as a feeding therapist, it has decreased tons of stress. It's very lightweight. I go into people's homes, and so I just throw my Nomi in the back of my car and take it. It's so easy. I literally can lift it up with one finger.
No, that's fantastic. And look at this. Here's a picture here. You can see it actually rests up on the table so that you can vacuum underneath it. This is when she's talking about lightweight. It actually, they're just very, very well thought out.
Yes.
Very well thought out.
And as us as designers for feeding products, this is awesome.
Completely. No, we love it. So happy. And I see Nomi here in the chat room. Thank you so much. And thanks for the amazing giveaway for all of our audience and all the moms out there. We're going to be running this until Thursday. Okay, so you have several days to go ahead and get your entry in. The entries can be taken here on Facebook and also on my Instagram feed. Okay, there it's the same giveaway. You can just do the entries over there or do the entries over here, and then you will be going over to the sign-in page, which is how we will be choosing. So make sure that you do go over and give us your email address. That's how we'll be announcing and notifying the winner. Okay, so fantastic. Yay, thank you. All right, let's pull this down and get busy with some questions here. Okay, you guys love that. Can we get some hearts for Nomi? Let's get some hearts going. Yeah, hearts from us. Okay. All right, so we had a bunch of breastfeeding questions and a bunch of feeding questions that came in. How about I start with a breastfeeding question, and then we'll go over and you can go ahead and pick a feeding question. And you guys, if you love this topic, okay, if you love this combination, I want to see you just telling me here in the chat. We would like to make this a very regular Q&A for you guys. Here's my thoughts about it. And I said this before. To me, Dawn and I are basically the continuum. Okay, to me, when we talk, it is where we can extend out and support you the longest with pretty much the same topic. It's honestly really the same topic, and there is an overlap. Okay, and sometimes you're doing both. Sometimes you've got a little one, a newborn who's breastfeeding, and you've got your toddler who's eating, right? And it's the thing that we're going to be doing every single day for many years to come. And it is the thing that we're focused on so much, beyond their sleep, which I did my sleeping Q&A with Rebecca last week. when I think of the one other thing that you have so many questions about, that is like, okay, now what? You taught me how to breastfeed, now what? And so I would like to keep bringing this to you, and we have some really great stuff coming. So fantastic. All right. Did you guys all do #MyBabyExperts to get your links? That's the link that gives you takes you to the giveaway. It also gives you some links for some wait lists of stuff that you definitely want to get on. All right. We got a wait list link over there. So make sure you're doing #MyBabyExperts. Let's do a question. And you know what? Here's something I also want to tell you. Okay. So this is what I did all weekend. All right. This is something I've been wanting to, I've been working every weekend, but this weekend was like labor of love. This weekend was like the best thing I've done in a really long time. And that means I actually started filming the new Simply Breastfeeding program. And we are going to be ready to launch that just in a few weeks. I've been busy writing for months, okay? And now I started filming, and we are going to have that ready for you. In fact, I'm going to have the first chapter ready for you so that you can preview it probably by the end of this week, okay? So I'm very excited to bring you Simply Breastfeeding. That is coming. It's been a long time that I've wanted to redo it. And so as I read your questions here, I'm like, check. Yes, we covered all of this. And I'm like, oh, good. Yes, we covered all of this. So let's go first to Iffy's question. That's her name, Iffy, okay? So she said, hey, Shari, is it normal to have pain when my baby latches? I'm almost 12 weeks postpartum, and I can hear her sucking sound too. All right. So let's just talk about that for a minute, because there's a lot of conflicting advice that people get. Like, it's supposed to hurt. It's going to hurt when the baby latches, and that's normal. So while some discomfort, like a little discomfort, may be okay and normal in those first few days or that first week after you have your baby, even if things are going well, it could feel a little abnormal. Think about it. You've never had the baby latching on before. Now the baby's latching. Some people will experience that as discomfort. Pain is never normal. Okay? Pain is never normal. That means if it's early on, the pain is an indication that the baby is not latching properly. Okay? If it's later on, it is never a normal thing. Okay? This breastfeeding should not hurt. And so I hear this all the time. And then I hear people, complaining like, don't tell people it shouldn't hurt because then they think that they should stop. And that's not what I'm saying to you. What I'm saying is, if it hurts, get support. Okay. If it hurts, pain in general. All right. Just let's look at pain. What does pain mean? What is pain in our body? With the exception of one exception. Okay. The only time that pain is normal and it means that things are good is labor. The only time that it's actually a sign that labor is working, that your body's working, okay? But the rest of the time, when we feel pain in any part of our body, including during breastfeeding, it's a sign that something's not right. It's our body giving us a signal, do something, get help, fix this, okay? And so I want you to not feel pain. We've also talked a lot in the past about how pain inhibits the letdown reflex, okay? How our bodies release milk is through the oxytocin stimulation from the baby sucking at the breast that stimulates oxytocin, that relaxes you. It's that love hormone, okay? It's supposed to keep you relaxed and helps that milk to just start to flow and let down, okay? But what are the things that can inhibit oxytocin? It's pain, it's fear, it's being too cold, it's being anxious. All of those things will inhibit your oxytocin release. And that's going to not only make the experience like uncomfortable, it's beyond that. It's also going to prevent the milk from flowing, which then the baby will get less, the baby will get more frustrated. If the milk's not flowing, then they may be, your milk could start to, your supply could start to be impacted by that. So there's a lot of reasons why you want to try to avoid pain while you're nursing. And the best way to do that is first identify, where is that pain coming from? Most often it's an improper latch, okay? Most often it's a simple adjustment that you may need to make to your latch in order to get the baby to not feel pain, or for you not to feel pain. And that's something that I go over extensively in the Simply Breastfeeding program, which is how to position the baby, how to also elicit those natural reflexes, those inborn reflexes and instincts that the baby has to latch on well. You know, one of the best ways to get your baby to latch well, and it's probably one of the least used ways of latching, is to do a position called laid back nursing or biological nurturing, where you're actually laying down, laying back, and laying your baby on top of you. The baby being in a position that is, you know, on top will actually stimulate the baby's reflexes to throw their head back and latch to the breast perfectly, okay? But it's often not used to get the baby to get a good latch. So we talk about that a lot in the program. But the main thing is answering her question here, is it normal to have pain? The answer is no. The other last thing, just the other thing that she's saying here is 12 weeks, she's hearing a sucking sound. While swallowing sounds are normal when breastfeeding, while that milk is going down, and it does sound, you can hear it. It sounds like it's in the throat.
Good sound. It's a good sound.
It's a good sound. It's the sound you want to hear. Okay. It's that gulping sound in the throat. Okay. It's different than a breath. That's fine. But the sucking sound, and I'm assuming what she's talking about is a clicking sound. Okay. A clicking sound during feeding means that the baby is unable to hold the seal on the breast, okay? That can happen sometimes from just having an oversupply and not having enough. The breast can sometimes be too tense with too much milk where the baby can't pull it back far enough into their mouth. But quite often that's caused from tethered oral tissues, like tongue ties and lip ties, okay? So that sucking, clicking sound that you're hearing, that combined with the pain on latch, those are two things that would give me the indication that there's probably a tongue or a lip tie. And when you have a tongue tie, when you have a lip tie, there's almost always a tongue tie. So you need to be evaluated, okay? The baby needs to be evaluated right away, even if you have a good milk supply. And sometimes you'll have your pediatrician say, oh, everything's fine because your supply is fine. That can be because sometimes the body overcompensates, okay, by making more, but it eventually catches up with itself, and then your milk supply can dramatically decrease. Plus, I'll let Dawn talk for a minute about the extended beyond breastfeeding, because it's the time we pick up tongue and lip ties. But there's other issues with tongue and lip ties that, even if it doesn't affect your breastfeeding, how it can affect your child later. Maybe you can talk about it for a minute, because
absolutely. And those are the two signs that I see often. So when I get called in that baby's not eating and they're really concerned and they have to go to open cup drinking because, you know, mom's still pumping and putting it into a cup and then doing cup drinking instead of actually having that nice bond with breastfeeding. Those are the two things too. You know, hearing those sucking sounds and having pain, that's immediately when I say we need to get an IBCLC involved, and I need to step out and you need to, you know, come in because of the fact of, like you said, not only will it start causing issues with breastfeeding, it also will cause issues with being able to have that connection. So that's the thing that I'm most concerned with coming from an older age feeding aspect, right? Is that if the bond already at the beginning with breastfeeding is starting to be compromised, not because mom's doing anything wrong, but because we have a cheek tie, a tongue tie, or a lip tie, then we are missing out on that attachment, which is very, very important when we're introducing solids, to be able to have that attachment and have that be really nurturing, which is why moms are breastfeeding in the first place, is to be able to have that beautiful relationship throughout. So we want that to be able to have that not impact that, as well as a really good strong swallow. So the tongue needs to be able to go back and forth really easily to be able to pull that milk. And we need to be able to have that good, it's called anterior posterior motion, to be strong enough, because then the tongue position changes when we go to solids. That tongue actually has to elevate up to the roof of the mouth. And if we can't go forward, we definitely, if that tissue is tethered, we can't elevate. So, and then a lot of babies will choke on solids and have difficulties being able to transition to solids. And then they're labeled as a picky eater, when actually, if we would have went back in time, and almost every single mom will tell me, yep, I felt like they had a tongue tie when I was breastfeeding and we had all these issues. And then now here we are starting solids and it's a very difficult thing. Not to mention speech delays, language delays, cognitive delays, so sensory delays. Because if you don't have the musculature to be able to elicit sensory movements, then you're going to have some sensory issues. So yes, it's important to be able to seek that out. So if you're doing the sucking and the pain, those are two signs. Not saying that that is a tongue tie, but those are the two big signs for my career as well as.
Yeah. One other sign, if you're thinking that you've got, you know, baby's got a tongue lip tie, would be also reflux.
Yeah.
Okay, often these babies are diagnosed with reflux. What's happening is the baby tends to swallow a lot of air. That clicking sound, that inability to latch to the breast properly, to maintain that seal, they swallow more air, and this is what they call aerophagia. Okay, and they actually swallow air, and then they wind up with a lot of spitting up.
Yeah.
You know, and a lot of gas and a lot of colic and just discomfort. And so these are very misdiagnosed. I have somebody, Jessica's asking, maybe you have an answer for this, Dawn. She's asking, is there a great, let's see, do you have a list of providers you recommend to get the baby evaluated? Do we have a list anywhere that we can, no, not really.
So it's really hard for families to be able to find that information. If you do write to us, what state you're in or what city you're in, we can help find someone in your area, which is, I know, a lot of work for us, but I have a list of friends that I trust that actually have a lot of good experience. But there's a lot of professionals out there that say that they can diagnose lip and tongue ties, and they're actually.
It looks like Stephanie is posting a link here for tongue tie. I think it's TTIT-supportnetwork.com. So, and I know Stephanie is our moderator. She's our assistant here. And so her son had this, and she knows a lot about it. Hopefully this is a really great resource for you guys. Fantastic.
Those are hard to find.
Thanks, Steph. Always count on Steph.
Thank you, Steph.
Okay. So very good. Great question. And, you know, sometimes the question comes in and it brings up all kinds of topics that you wouldn't even know how to ask. And, you know, I want to, the new membership site that I'm launching, let me tell you a little bit, because this is one of the reasons why we're doing this. You know, I have a video library of over 1,000 videos when it comes to the episodes that we've done and all the clips from them and all the Q&As. And we were able to go back, and some of you guys, you actually have been helping me. We have a bunch of mamas I've had my army of people who have been working with me to time code all of these things. So Q&As like what you're seeing right now, okay? We've actually gone back, believe it or not, through every Q&A I've ever done, whether that was here with Dawn, with Rebecca, with Jamie Grayson on the baby guy, okay, all the Q&As we've ever done, and we've time coded every Q&A so that when you come into the membership site, there is a very sophisticated search functionality so that you can type in what it is that you're looking for, and it's going to pull it from any time that I ever discussed it. All right, so that you will have the ability to go back without having to watch every Q&A from beginning to end and find what you're looking for. You know, I've said over these years, I've said just about everything, but where did I say it? That's the question. All right, so that's why I thought that search is going to be so helpful for you guys to be able to do that. And so that's part of what we will have available for you is that searching. And one of the things, Dawn, that we did was, you know, and why I brought this up was, you know, so often, like I could do a search where it says, you know, I want to know about tongue tie. But what if you're a mom and you're like, I don't even know what tongue tie is? So often when you need to know the answer, you don't really know what the question is. Yeah. So that we have a whole other piece of this, which will come in as frequently asked questions. And you guys, without knowing it, are building that out for me right now. With the questions that you provide me each week and on here, we are taking your most asked questions and understanding that this is what you need to know. All right. And so this will also pull up those answers. So I just want to make it something that is going to be the most helpful. the most helpful and the most supportive so that you can have a really joyful experience as you transition to all this. This can either be scary and difficult, or it can be challenging and it can be tiring, but it can also be joyful. And that's our goal, is to make it that. All right. So I hope you all are going to love that. Fantastic. Okay. So how about Dawn? You know what? Why don't you go ahead and answer a question that came in?
Okay. Yep. So I'm looking at our Facebook page, and Amanda Adam asked, when is the earliest that we can give our baby solids? We have been getting many different answers from people, and we know every baby is different, but how do we know how long to breastfeed and when it's okay to give baby solids? So I'll start off with that question. So it depends on your feeding method. So if you're going to start off and you want to do purees traditionally is, I call it the traditional method. And that is when traditionally you offer baby purees. You as a feeder are in control. You are scooping up that bit of food to the spoon, and you are offering that bit of food to baby. You are in control. You are offering the purees. You can do that at 4 months of age. However, the American Academy of Pediatrics, the WHO organization, and any feeding specialist highly recommends waiting till 6 months of age. And there's a variety of reasons to do that. And that's a whole nother talk show that we could talk about. Mm-hmm. But you can do it at 4 months of age. I have some babies that are medically fragile that maybe have to have like a heart surgery, or they need to gain weight really quickly for some kind of medical procedure. And I absolutely will work on that with parents at 4 months of age. But I love to have families wait until 6 months of age. Mm-hmm. But traditionally, you can start to serve babies 4 to 5 months of age using the puree method. Mm-hmm. Then there's another feeding method called baby-led weaning. And what baby-led weaning is that the parent is passive. The baby is the active feeder. So basically you are putting foods onto the tray or onto a plate or bowl, and baby is actively grabbing those foods and eating that. You are watching and supporting baby and helping baby, but you are actually not feeding baby. So baby is self-feeding and being able to actively have those foods. Now, there's a couple other questions that said, can you start baby-led weaning earlier than 6 months of age? And the answer is no. And the reason why is because baby has to be able to make all of these gross motor milestones and fine motor milestones before you can actually give baby a piece of solid food. So one of those milestones is that baby has to be able to sit up on their own and not face plant when you sit them into the high chair. And so baby needs to be able to have all of these signs, and traditionally those signs don't come in until 6 months of age. And the Dr. Rapley, who started baby-led weaning, says, absolutely do not start baby-led weaning until 6 months of age, or 6 months adjusted. So that is an answer to that. And then Shari, do you want to talk more about how long do you breastfeed and when it's okay to?
Yeah, I mean, my recommendation is to not introduce any solid foods till after 6 months. And I say after 6 months because it's not that they have to eat solids at 6 months. Okay, this is where moms get really scared. Oh, the baby doesn't want it. I'm forcing them to have solids. They just want the breast. That's okay. Okay. Right. It means that we don't want to do it sooner than that, but some babies take longer, and you're not looking, just like all things that we talk about. It's not just that you're never looking at the clock or the calendar in this instance. Okay. What we're looking at is signs of readiness for your baby to know when it's time to introduce solids to them. Okay. Waiting till 6 months is important because we want to make sure that they're getting all their nutrition from breast milk. Yes. There's also physiological reasons that you want to wait until 6 months, not to introduce anything else into your baby if possible. I mean, ideally, you want to introduce nothing, no infant formula, no food, just breast milk. It's going to help to maintain the proper and the healthiest bacteria of their intestines to maintain their health. Okay, that's how they get their immunity, and the health of their intestines through their microbiome is really the way to do that. The less you introduce, the better. All right. So wait for signs of readiness. Maybe Dawn can talk a little bit about signs of readiness. This is just it's a very general thing that everybody needs to know. Signs of readiness of how do I know my baby's ready for solids? And the last thing I want to say, just when it relates to breastfeeding, is that if your baby is then ready for solid foods, please still continue to make your breast milk and breastfeeding the priority in feeding. Okay, that means we're going to keep feeding the baby the breast first and then following with solids. We're going to make sure that we're not, skipping breastfeedings, and we're not going to decrease the amount that we're giving, or we're going to still make sure the baby's getting their breast milk, the breast milk. Okay, there's so many reasons, and the nutrition is there. But I also believe that, this saying that we hear that, food before one is just for fun. I don't agree with that. And I know Dawn doesn't.
Not at all.
It's like, it sounds good because it rhymes, right?
Yeah.
That's probably the best thing about that statement. Is that it actually rhymes.
That's the only thing. That's the only thing. Because it's inaccurate information.
The only cute thing and accurate. The only accurate thing about that is that it rhymes. Okay.
Right.
But why I say that is because there's so many more reasons that your baby actually does need to begin to have solids before 1 year of age, but not necessarily for their nutritional intake. Okay. And that's where it gets mixed up. Okay. Yes, before 1, their nutrition comes from breast milk, but before 1, there are other reasons that they need to start introducing solids. I'm going to pass that back over to you, because I know that you and I both agree with this, and you can tell them all the reasons why.
Yeah, I will add into that, just because the food before 1 is just for fun. It's like a chalkboard. Because, and then, well, let's start there. So many reasons. One is developmental. So if developmentally, baby is supposed to be doing all of these things that has to do with food. That does not necessarily mean that it has to do with actual intake. It has to do with the sensory aspects of that, the fine motor skills to be able to do that, to actually take food and being able to put it into their mouth and be able to swallow it. It doesn't mean that they're going to swallow 5 ounces. It just means that they're able to do those skills. So from a sensory perspective, it's really important for this to happen from a fine motor perspective. And we're actually working on the oral structures. Again, as a feeding specialist, I'm also a speech pathologist first. So all of these movements that happen with food is feeding milestones precede speech milestones. So if I have a baby that's, 10 months of age and still not babbling, I'm always looking at their feeding. And if that same baby, my first question would be like, have you introduced solids? And the moms are usually like, no. I'm like, well, as soon as you introduce solids, your baby will start babbling, because it's basically, we have to have these feeding milestones before speech and language even sets in. So we really need to be able to experience the joy of food with baby to be able to help make those developmental aspects happen. And again, some babies will have 2 tablespoons and just jump right into it. And other babies, it takes a couple of months, but we still need to be able to offer and be able to provide that intake for them, not to overstate what breastfeeding is doing. Absolutely not, but to actually enjoy the process of mealtime. And there's so much socialization that goes along with that too. We're going from, one-on-one with breastfeeding to being at the table with the whole entire family. And so there's all this socialization and different things that also happen. And of course, that's the same amount of time from a speech perspective that baby starts learning all this receptive language. And because as soon as baby comes to the table, boom, the receptive language just skyrockets, right? Because baby's being exposed to more of that socialization. But to go back to the signs of readiness and Ruby's—
one more thing I was just going to throw in there as you were saying that, it's one of the reasons why I love the Nomi too, because you can actually bring baby to the table as an infant. So they're literally at the table with you. I'll pop it back up again so you can see there is the infant seat here, that attaches at a height that will bring them right to the table. And this is intentional.
Yeah.
I mean, again, just for everything that Dawn just mentioned about the socialization and being part of the family, and even though they're not eating solid foods and they're not going to be able to sit upright, but they could start right from the beginning to be there with you. Eating is a very social, okay, it's beyond just nutrition, all right? Eating is social. Eating is community, right? Eating is a time when we express love to each other as well, right? So it's just this thing that will bring them into it right from the beginning. And I love the chair for that reason too.
Oh yeah. And quick side story with that. I have a mom that's an accountant, and she did that. She brought baby up to the table before baby's even eating, and she's an accountant. So she'd always be using her calculator. And of course, as baby grew, is her favorite toy. And I was like, well, yeah, she was at the table with you while you were working, you know, hearing that calculator, you know, as an infant.
Very soothing sound.
And of course she wants to that's her favorite toy now, of course. That's what she was exposed to.
It's really funny.
You know, from a cognitive standpoint.
Anyway, I interrupted you. I want go back and talk about signs of readiness for
Yes. So Ruby Campos had a question. When is baby ready for food? You know, what are those signs? So let's just go into that. So what we're going to be looking for, and I'm going to kind of step back a little bit so you can see my side profile, is we want baby to be able to lean forward, to be able to grab food. And then we want baby to also be ready to lean back. So if baby kind of leans forward and kind of gets stuck here, we also need baby to kind of lean back. That is a sign of readiness, being able to move forward, being able to reach. If baby's, if you're eating and baby's reaching and trying to do that, or watching you really intently while you're putting the food into your mouth, or watching everybody as they're putting food into their mouth, those are all signs of readiness. Other signs of readiness is being able to move their head. So what's really important is not only for signs of readiness, but also signs of fullness, is that baby needs to be able to move their head. So they need to be able to turn their head to kind of say, I'm full, I'm all done. So they need to be able to move their head and rotate that, and actually move their head to kind of watch what's happening. So we want to make sure that we're looking at what the head is doing. And we're also wanting to look at the mouth. Is baby drooling while you're eating? Is baby sucking on their fingers while you're eating? These are all signs that baby is hungry and really wanting to participate. Now, with that said, those signs of readiness can happen at 5 months of age. And again, if baby is showing you all those signs of readiness and leaning forward and really have that good positioning, and you can put some bolsters in on the sides to be able to keep baby in a stable position. But we want to make sure that baby's able to kind of lean forward towards that tray and then lean back and be able to be supportive. And the Nomi is great for that. The tray actually helps with positioning as well as the restraint system. So it's a really good duo to be able to help give baby that great support and stability, and being able to move that footrest as well as a seat rest. You're going to find that with the Nomi, particularly, that 5-month-old might actually be ready because of the fact that you've got so much positioning. And of course, we're going to start with purees then, and not with huge solids like you would with baby-led weaning. So there's some signs of readiness.
Yeah, I mean, we're not hearing this everywhere, but you know, it's not just about, oh, they got a tooth, they're ready for food. We hear that a lot. Oh, well, they had teeth, so I just assumed, you know, they were 3 months old and they were ready. And then the baby, you're trying to stick food into the baby's mouth, and the baby's pushing it back out with their tongue because they cannot, they need that tongue thrust that's happening early on, is how a baby latches to the breast and how they suck at the breast. And so if you see your baby pushing that food back out with their tongue, it's not that they're actually rejecting the food, although they may be actually rejecting the food. Their bodies are rejecting the food. Let's put it that way. The natural reflex and the function of the tongue is showing you that they're not ready. They need to be able to bring the food back rather than pushing it forward.
Right. And they can get that with practice. And again, that's another reason why that 6-month-old window is, from a developmental standpoint, at 6 months, that tongue is going to slowly start to retract. But again, with that combination of breastfeeding and going to solids, the number one thing too, and there's some questions about this too, about cups, is not to go to sippy cups at 6 months. There's a lot of inaccurate information out there, again, one that says, oh, you know, at 6 months of age, you're starting to transition to solids, so you should transition to a sippy cup and start putting your breast milk into a sippy cup. And the unfortunate thing with that is then it actually keeps that tongue thrust coming out. And that's what we don't want. We want that tongue to actually go back and forward for breastfeeding, but we want that tongue to go up when we're actually eating. So it's really important to, if you want to introduce a cup, and again, these are some of the questions that are coming in, is to introduce an open cup to be able to do that, not a sippy cup with a spout. We want that tongue to be able to go up to the roof of their mouth. And again, if you've been on a live with me before, I'm going to have everyone do this again. Bear with me, everyone. If you could swallow your saliva and notice where your tongue is. So swallow your saliva. Your tongue is going to go up to the roof of your mouth. That is a mature swallow pattern. And that's what we want baby to start being able to do around 6 months of age. So as a tongue is actually going in and out and learning to start to come up and come forward, if you transition to an open cup, that means a cup with no lid, and being able to transition to that and without a lid and without a spout, then baby's going to be able to actually practice that movement with the tongue going up to the roof of the mouth.
Such good advice. Absolutely. And it's not what you're typically hearing or seeing or being sold on. You know, you walk into a store and what you're going to see is all sippy cups, right? And so, but that doesn't mean that that was designed or recommended by an expert in this. So make sure that you, I have somebody here, La Quinta said, I'm new and I love this Q&A session. I'm going to pop her up there. Yeah, I'm so happy that you are and you're enjoying it. I'm loving it too. And I know you guys are loving it. We're going to have more of this. And if you're not part of the private Facebook group, that's the My Baby Experts community, what are you waiting for? Go join. Okay. There are links in, if you type hashtag experts right now, okay, you'll get a message from me and that will give you links to everything that we are talking about, including the giveaway for the Nomi high chair. Okay, we're not going to be pulling that winner today. It's this is open to anyone on Instagram and Facebook for the rest of the week. It's a big prize, and I know there's a lot of mamas who can't make it to the live streams because they're working, and yet they need to be a part of this fabulous giveaway. Okay, so if you want to get all the links, please go ahead to just type in hashtag MyBabyExperts. You'll get a message, and it will also give you a link to the Facebook group. Dawn and I will be back in the Facebook group a lot and soon.
Yes.
And so if you're enjoying this Q&A and you're who's learning something, okay? Because I know she talks and I learn, right?
She talks and I learn.
Love it. Okay, I'm just like, yeah, keep going.
We talk and you learn.
Make her scream big. I'll go little here because it's just so interesting and so helpful. So if you're loving it, let's get some hearts so we can see if you're loving it as much as we are. I think we're having more fun than anybody does.
Yeah, this is true. This is true.
Anytime Dawn and I can, just so you know, anytime we can spend some time together and talk about this, we're in heaven, basically. Yeah. We're in heaven. Yeah. And I don't know if you could feel that, but we are.
and for one reason, and again, because we're in this space, you don't know, but it's very rare to find a medical expert that's as knowledgeable as you and that gives accurate information. That sounds crazy and it sounds baffling. Even when it comes out of my mouth, it sounds baffling to me. Yeah. But it's just, there's so many people who just don't keep up their continuing education and that really don't know what they're talking about. And so it's frustrating. So I really love that we can just kind of go back and forth and be able to, you know,
and we're on the same page for so many things too.
Yes,
it's really great. I do have one more question. We have a few more minutes. I'm going to answer this question because I think that it kind of leads into what we just talked about a little bit. This came in from Christine. She said, "What are the signs of drying out, or is it just a myth? What is the best way to maintain a healthy milk supply well past 6 months postpartum?" And again, I just filmed this, actually just wrote this chapter in the new program about your supply. And I actually have a whole course on low milk supply that will be part of the membership site. So it's being edited right now. It's an entire course on low milk supply. And Sorry, I've been filming, so I really literally lost my voice, and you've been sick. So the two of us together are our team today.
Cough, cough, clear, clear.
Let's talk about drying up, like the whole time.
Drying up with their throat and breast.
Drying up, and is it just a myth? Drying out, she said. You know, it's not a myth in the sense that can you have a decreased supply for one reason or another? That is not a myth. That does happen. But the idea that you would have a good supply, that everything's going well, that there is no reason at all for your milk to just dry up and then just one day you just dry up and you can't breastfeed anymore, that just doesn't happen. Okay, do people think it's happening and then start turning to formula and then actually cause the issue that they never really had in the first place? Yes, that happens every day. Okay, so when I talk about low milk supply, we actually group it into 3 different categories. You know, there's the primary reasons, there's secondary reasons, and then the most common reason for low milk supply, which is perception. Perceived low milk supply. Perceived low milk supply is probably the most common breastfeeding issue there is. What that means is there's no real issue at all, but the lack of understanding when it comes to how much a baby should be eating, what a normal breastfed baby does, what their behaviors are, how often you should feed them, how often they want to eat, you know, what looks like when you're going through growth spurts, you know, how much weight should they be gaining, and do they have to gain a certain amount every single week or day? All of these things lead to this perceived low milk supply. That then what winds up happening is you start doing things, whether that's your baby should be sleeping more. I just had this with somebody, you know, she called me, she said, you know, I was doing fine. I was making all this milk, and my pediatrician said the baby's 4 months old now and weighs enough where the baby needs to be sleeping through the night. So insisted that I cut out that nighttime feeding. The baby's crying at night. She's rocking the baby. She's not feeding the baby, and her milk supply is now decreasing. And it's that kind of extremely inaccurate advice that is what's causing some of this. And I want to take that burden off of each of you as a mom, because really, when we talk about that, that's not your fault at all. That's how I feel. Like, none of this is your fault, none of it. And so often we feel so much guilt when we are unable to breastfeed, or we make choices that, you know, you're not able to reach your goals, okay? But so much of this is not your fault. It's lack of education among professionals that are the ones who are supposed to be there guiding you along the way. They're the ones who are supposed to know this, okay? But they don't. And often that's what's causing this perceived supply issue. So this idea that you would just dry out, if you dehydrate yourself, yes, you might start drying up your milk. If you are not having a good latch, like we talked about earlier, and you're feeling pain and there's a tongue tie and nobody's saying it and you're not getting support, yes, the milk can start to decrease. Can you have primary issues for low milk supply, like hormonal issues, PCOS, low hypothyroidism? Those are all reasons that, yes, you can have a low milk supply. But in most cases, even with those primary issues, getting support from the appropriate professional, like an IBCLC, getting help right away, not waiting, all those things you can do something about, and you can be supported to still have milk. And even if it wasn't a full supply in some of these primary conditions, you can still do some breast milk, and any breast milk is better than none at all. But the idea that your milk would just dry out, most likely it's a growth spurt that you just didn't know was a growth spurt. And so the baby looked super hungry, wanted to eat every hour. You feel drained and empty, and you're like, you know, your mother-in-law is saying, well, give the baby formula, you know, you're starving your baby. And that introduction of the supplementation, yes, if for the moment, gets your baby to calm down, feel full, and never gives your body or your breast the signal that it needed, which was feed more, drain every last drop, because in 2 days, you will bounce back with that much more. It's a perfect harmony that you and your body and your baby have to be able to stay in sync. And it's really about getting out of the way. It's about following their cues, not following the clock, and looking at your baby and knowing that your body knows exactly what to do, and so does your baby.
Yes.
You know, and when we try to figure it out and put this into some kind of a box, or take some inaccurate advice, we cause problems. We actually cause those issues that never were there in the first place. 6 months is a time when sometimes you start to introduce solids. And so in a normal way, your milk supply might start to decrease. This is normal though, right? So they're getting some of their nutrition from solids. Your supply might start to drop. It's the time when I had my store and people would come in for bras, you know, during their pregnancy. And I would say, well, these will fit you. I can guarantee, I used to guarantee the fits. I'll fit you at 20 weeks of pregnancy and I'll guarantee that sizing until you're 6 months postpartum. Right? And they'd say, well, okay, but what happens at 6 months? Why won't you guarantee it? Well, because sometimes your breasts shrink at 6 months. Okay. Sometimes your supply goes down. Sometimes your breast will shrink. And if you've had that happen, right, all of a sudden 6 months, it's like, oh, I need different bras. I'm like, these have no support anymore, because there is changes that happen. Often you're back to work. Often you are getting your period again. Those things can start to decrease your supply as well. So, I would just say the answer to, will you just dry out? I call that a myth.
Oh, I like that.
Mm-hmm.
Yeah.
Yeah.
And what's interesting when I'm hearing you say all of this is that literally you could take out the word breast, which is, you know, the whole title of our thing, take out the word breast and just say feeding, because it's the same thing. It's the exact same thing.
Yeah.
If there's not that following of those cues, if it's not listening to baby and actually, you know, moving in tandem with baby during all of these changes, those are the exact same things that we need to do and learn when we are starting solids and being able to do that. And unfortunately, the same thing happens. Medical professionals will be like, oh yeah, you can introduce water now instead of breast milk. What? Like you don't need to continue to breastfeed with starting solids. What? Like it's just all of these inaccurate information. And of course, then now we're perceiving these feeding issues that wouldn't have been there. Or, you know, all these feeding myths, again, for starting solids are, you know, coming from, again, well-meaning people and well-meaning medical professionals that just don't know.
Mm-hmm.
And again, every time I hear you talk, I'm like, yeah, you could just use the same exact advice. Mm-hmm. And that's what I love, that if you're a mom right now and you are on this and you are breastfeeding, you're going to listen to all of Shari's advice, and it'll be the same types of advice that I'm going to be sharing with you as we go through this journey with starting solids, because it's the same developmental things that we have to do. We have to watch this developing baby that is developing differently than anybody else. Mm-hmm. But still we have these ages and ranges and different things that we can support you with accurate advice.
Yeah. And so please go and put your name on the wait list, okay? Because you will be very happy you did. I promise you. We are going to have just a 4-day stretch in August. It'll only be 4 days that you'll have the opportunity to join the membership, and then it's going to close for about almost 2 months, okay, while we build it out together. So if you want to be notified and you don't want to miss that window of 4 days, okay, plus you're going to get it at a price that nobody's going to get it at ever, okay? And I'm talking like under $20, like cheap, like not expensive for what we're going to do together. Plus like just so much good information. If you're loving today, this is a good hint of like, you're going to get more of this. All right. So if you love this and you want to be a part of our My Baby Experts membership in those 4 days, make sure that you are on my list so that I can notify you. We will be closing it on the 14th of August, and then there will be no way to get in for a little while. Okay. And I need you guys to help me build it out. We have a lot of content that we need to create together. We're going to do that in a private Facebook group that is different than the one that we have now, okay? And we'll be filming a lot of it live in front of you, so you get to be part of the whole process. So I'm excited. And first of all, I just wanted to make sure that I thank Nomi again for that amazing prize for everybody this week, okay? And the amazing product that they've created. And Dawn, thank you for being here with me. And I'm looking forward to many more.
Yes. And thank you, Nomi, from the bottom of my heart as well. And moms that you are on, you seriously, this is the best high chair on the market. And you absolutely will love this. And last thing, the one thing that we didn't mention was the actual cleanup of the high chair. Like I feed babies every hour.
Oh, wait, I have a really good picture. Hold on.
Yeah. And cleaning the chair is easy. There's no like cracks and crevices. And then actually lifting it up is so simple. It literally will take you a minute. And again, I'm all about less mess. So that is another thing that I just love about it. I mean, we could.
There was this really cool picture here about the
those colors.
So cute. There was a really cute picture on the tray here too that they gave me, where it just wipes really clean.
Yeah.
And so, where is it? Oh, there it is.
That's the stains. So they put that on for hours, all these different substances that traditionally stain high chairs. So if you have a high chair right now and you're using a tray and it gets stained really easily, it will not happen with the Nomi. Again, I have this is actually my tray from my Nomi. I use a Nomi every day in feeding, and you can see how clean it is. I've fed hundreds of babies on this tray, and again, all different nationalities, all different cultures I work with. So there's different curries and hot sauces and a whole bunch of different colors on here, and it doesn't stain. So I love that they show that and kind of prove that, you know, especially if you get white. A lot of families I work with get white or gray, and so it doesn't stain.
Totally. Here, I can bring it up bigger so you can see all the different foods in there. There we are. Very cool, right?
Yes, amazing. And gutsy. That's a really gutsy picture. And
that is a gutsy picture.
Yeah, it's true. And so that's, again, when you're buying a high chair that's going to grow with your baby and that you're going to really invest in, you want something that's actually going to last and not look stained, 3 years later.
Totally. No, you want this to last, right? We want this.
And it will.
And it will. And it will. Dawn, thank you for joining me.
Yeah.
I wish you were here. I wish you were here with me.
Me too. It'll happen. It'll happen.
We will do that. We will do that. Okay, you guys, we're going to say goodbye for now. Make sure that you entered. Make sure you're on our wait list. And then we'll be back soon. Okay.